Nagaland reports 16 new cases of the novel coronavirus today, the lowest reported in over a month. Recovery rate from COVID-19 continues to improve further to reach 74.69% today. Over 22,22,000 people have recovered in the country so far. And CBI requests AIIMS New Delhi to review the death case of Bollywood star Sushant Singh and give its medico-legal opinion. Well, those were the headlines. Hello and welcome once again to this news broadcast from News and Trends. We begin this bulletin by taking a look at the COVID-19 update from the state. Nagaland reported 16 new cases of the novel coronavirus today, with the fresh cases reported from 4 districts of the state. This is the lowest case reported in over a month. The state reported 18 cases on 15th August, 20 cases on 11th August and 25 on 20th of this month. State's Health and Family Welfare Minister S. Pangipom informed this in a tweet this afternoon, stating that 16 new positive cases of COVID-19 have been reported out of 723 samples tested. 12 were reported in Kohima, 2 in Twensang, 1 each in Wokha and Longland. Necessary contact tracing has been activated, the minister added in his tweet. Of the total 16 cases reported today, 9 were from the armed forces, 3 from among the returnees, 3 from traced contacts, and 1 from among the frontline worker. The minister also tweeted to inform that the state reported 92 recoveries of COVID-19 patients today. 72 were reported from Kohima, 18 recovered from Dimapur and 2 from Perin. However, all recovered patients shall be kept under strict surveillance, the minister added. Kohima, which reported the majority of the cases today, is the second worst hit district hit by the pandemic after Dimapur. More areas in the Kohima municipality continues to be sealed as more cases of COVID-19 positive have been detected from traced contacts. ADC Kohima Litrongla Tongpi Rutsa, in an order issued today, has declared 5 locations, including the official residence of Advisor Veterinary and Animal Husbandry at Old Ministers Hill, and cabin numbers 1, 2, 3 and 5 of Oking Hospital as sealed areas. The houses located at Old Ministers Hill, Pekrazu Colony, PKL Kohima Village, and a government quarter at New Ministers Hill have also been demarcated as sealed areas in order to contain the spread of the disease infection and for necessary contact tracing. The order stated that all movement of persons, vehicles within the defined sealed area is strictly restricted, prohibited and under active surveillance with immediate effect from the date of sealing. With an addition of 12 new cases today, the total number of COVID-19 cases in Kohima district stand at 1,021. 559 persons have recovered and there are 460 active cases. 2 persons have migrated. Longland, which remained COVID-19 positive free district for over a month, today reported 1 case. 3 cases were reported from the district earlier so far, and all the 3 patients had recovered from the infection, making it COVID-19 positive free district along with Thek. However, with a fresh case of the virus reported today, there are now 1 active case from among the 4 cases reported till date. Twensang too reported fresh cases after a week. The last time the district reported a case of the virus was on 15th of this month, when the district reported a case. Total positive cases in the district stand at 50. However, with 45 persons recovered from the infection, there are now 5 active cases in Twensang district. An addition of 1 more case of the virus takes Wokha's tally of total positive cases to 21. 17 patients have recovered and there are now 4 active cases in the district. According to the Nagaland government COVID-19 War Room dashboard, the state's tally of positive cases now stand at 3,635. Recoveries stand at 2,166, 7 deaths have been reported, 6 have migrated and active cases stand at 1,454. In another case of high-handedness by uniformed personnel, a doctor on COVID-19 duty was physically assaulted by an IRB patrol party at Dobhi Nala, Dimapur last evening. Dr. Atoko Watsa, a pathologist on active COVID-19 duty in charge of the COVID care center Chumugidima, was allegedly punched and hit with a stick by IRB personnel on patrol duty. The incident occurred around 10 p.m. last night when the doctor was on his way to Hotel Saramati after picking up a fresh set of clothes from his home. Doctors on COVID duty are being lodged at various hotels in Dimapur in keeping with the standard operating procedure of the government for frontline workers. They are permitted to pick up essentials from home once a week. Reacting to the incident, the COVID care center Chumugidima was closed down this morning. A public notice outside the center informed that the CCC would not be functioning temporarily till the IRB explains the assault on the doctor in charge of the center. A message on social media describing the alleged incident from Dr. Watsa read that he was assaulted by IRB personnel near his home instead of saving him from 5 drunk guys who were drinking on the road with their car parked in middle of road and blocking him. They also damaged his car. Was on his way to Hotel Saramati after taking some clothes from home. The message read that he will be needing few days rest, thoroughly upset and shaken. It did not specify the time and exact location of the incident. The Commissioner of Police and the District Chief Medical Officer were still to officially comment on the matter. Meanwhile, reacting to this incident, the Nagaland In-Service Doctors Association Dimapur unit has condemned the incident and has demanded immediate suspension of the personnel involved within 24 hours and proceed action for termination, failing which the medical fraternity will take its own course of action. They have also demanded judicial inquiry into the incident. The association has also asked to bear the medical expenses incurred during the course of the treatment and compensation of the damaged property. The recovery rate from COVID-19 has improved further and now it has reached 74.69% today. During the last 24 hours, 63,631 COVID-19 patients have recovered. With this, a total of over 22,000 people have recovered in the country so far. The case fatality rate continues to show steady decline and now stands at 1.87%. With a spike of 69,874 infections in a day, India's COVID-19 tally increased to 29,75,701. There are 6,97,330 active cases of coronavirus infection in the country. 55,794 people have died due to the infection in the country. Maharashtra has reported the highest number of cases, followed by Tamil Nadu, Andhra Pradesh, Karnataka, Uttar Pradesh, Delhi and West Bengal. In the northeast, Assam has reported 87,908 cases of the pathogen. A total of 8,371 cases have been reported in Tripura, 5,049 in Manipur, Arunachal Pradesh, 3,126. Meghalaya has reported 1,718 cases, Sikkim 1,336 and Mizoram has registered 903 infections so far. The overall number of global COVID-19 cases has increased over 2.93 lakh, while the deaths have topped to more than 7.98 lakh, according to the Johns Hopkins University. The US accounted for the world's highest number of infections and fatalities at 56.21 lakh and 1.75 lakh respectively. Brazil came in second place, followed by India, Russia and South Africa. The World Health Organization (WHO) hopes the coronavirus crisis can be over in less than 2 years, WHO Chief Tedros Adhanom Ghebreyesus said yesterday. The Spanish flu that hit in 1918 took 2 years to end, he said. He said, our situation now with more technology, of course, with more connectiveness, the virus has a better chance of spreading. It can move fast. At the same time, we have the technology and knowledge to stop it, he added. More than 22.93 million have been reported to be infected by the coronavirus globally and 7,98,846 have died, according to Reuters tally. The CBI has made a request to the Forensic Department of AIIMS New Delhi to review the death case of Bollywood star Sushant Singh Rajput and give its medico-legal opinion. A medical board of forensic experts have been constituted by AIIMS under the chairmanship of Dr. Sudhir Gupta to study the case and submit its findings to the investigating agency. CBI will provide necessary medical reports to the forensic team for the analysis, based on which the team will analyze the injury pattern in relation to the medical findings in the case. Now back home, Nagaland Minister for Planning and Coordination, Land Revenue Parliamentary Affairs Niba Krono yesterday released a 2-volume report of the project Geospatial Water Resource Map of Nagaland at the office of the Nagaland GIS and Remote Sensing Center. The project had been carried out with thorough research and intensive field survey with special emphasis on surface water resource management and development of hydroelectric power (HEP) generation potential for the state of Nagaland, said Project Director, Nagaland GIS and Remote Sensing Center, Mathang Kithan. He said the report contains mapping of the entire river system, drainage network, the drainage pattern, and preparation of large-scale watershed delineation and morphometric analysis of the 22 watershed and the survey and assessment service water runoff discharge in more than 100 different locations across the state. During the release program, Minister Krono congratulated the officers and staff of the State GIS and Remote Sensing Center for successful completion of the project and further encouraged the center to take up more such programs in future, taking advantage of technology and meeting the challenges faced by the state. He stated that the report shall provide impulsion in the development of HEP, irrigation and drinking water availability, as well as for monitoring of water quality and quantity in the state. He informed that state-line departments such as water resource, power, new and renewable energy, land resources, PHED and disaster management, etc. will greatly benefit from generated geospatial database as it will provide them the tools to plan with more precision and accuracy in the area of water resource programs and schemes. Principal investigator for the project, Chubawati, gave a brief overview of the technicalities and the process through which the project was carried out in a slideshow.
Being able to set foot in all the major rivers of Nagaland. So we have visited around 100 spots covering the entire river systems of Nagaland. And then we have taken this as we can see from this video.
And with that, we come to the end of this news bulletin. Do follow us on our Facebook page and Twitter and stay updated with the latest from across the world, the country, the region, and from the state as well. Meanwhile, stay safe, practice safe health hygiene, and maintain social distancing wherever you go. But most importantly, take good care of yourself and your loved ones. Thanks for watching.